So what is cardiac output? Basically, till now we learned about cardiac cycle, okay, and whatever require, what is the pumping functional functional capacity of the heart, we didn't read till now. Okay, we learned about how the heart pump the blood, what are the requirements, we study structures. Okay, there are four chambers. Okay, there are four valves. Okay, and some chambers will receive deoxygenated blood, some chambers receive oxygenated blood. From that, the blood goes to the lungs, comes from the body, and from the lungs it will receive from the heart to go to the other parts of the body. So this is the functional, what is the function, what is this is the function of heart. Now we will study cardiac output. So basically how much amount of blood will come from the lungs, come from the body, okay, go from the lungs to the heart, from the heart to the body. So this is all things related to the cardiac output. Okay, here cardiac output in another means what we want to know, that is the amount of blood coming from outside of ventricle in 1 minute is known as cardiac output. So basically we have ventricle, auricles. This is the heart. So this is the ventricles, auricles. Okay, do have deoxygenated blood, oxygenated blood, valves. Okay, aorta. Here aorta, sorry. Vena cava, superior, inferior vena cava, and pulmonary artery, pulmonary vein. Okay, so the ventricles, the amount of blood is pumped through the ventricles in a minute is nothing but cardiac output. Okay, so basically our metabolisms will continue in the cell, will happen continuously. In the cell, the metabolism will continuously happens. Okay, like uh, lungs, lungs functioning, always they function. Heart, they function continuously. Like kidney, kidney also function continuously. So because their cells are functioning continuously, so we can assume that metabolism also continuously happen. So they need oxygen, they need nutrition, and they need other things which are related to them to normal functioning. Okay, so so they need normal amount of blood because blood contains all those things. We have oxygen in the blood, we have nutrition in the blood, we have other related things which are helpful to the organ are present in the blood. This is the one thing. Second thing is that after metabolism, what will happen? The ab waste products will produced by the cell have to be eliminated from that part. So contraction means the blood in the cells, waste blood or deoxygenated blood will come out from the cells, and oxygenated blood will go to the cell while contraction. Okay, so we have to calculate about that how much amount of blood needed by the body in 1 minute. Okay, to needs, what is the need of the body? How much amount of blood need per minute is calculated by cardiac output. Okay, we have to know two things. We must know the pulse rate. Okay, first thing we have to know pulse rate, and second thing is stroke volume. Stroke volume means is the term of amount of blood pumped by ventricle per beat. Here, for one beat, how much amount of blood is going out of the ventricles in one beat? How can we know that? Let's study about that. Okay, stroke volume is 60 to 80 ml. So here, direct answer is given that 60 to 80 ml. After research, they know about that how much amount of blood will go for one contraction, that is 60 to 80 ml per beat. A simple formula that enables to us to determine cardiac output. Okay, cardiac output Here we have the two things. One is stroke volume, pulse rate. Stroke volume is 60 to 80. Okay. Heartbeat, pulse rate, you have to check the pulse, or else you have the pulse oximeter, or can check manually the pulse of the patient. Here, example is given. Volume is 70, pulse is 70. So cardiac output is 70 ml into 70 beats per minute. So 70 into 70, 490 ml per minute. Approximately 5 liters of blood, okay, is going out from the cardiac in 1 minute. Okay, so this is the normal thing. Okay, in 1 minute, the heart is pumping 5 liters of blood. So this is the uh, function of heart. Naturally, cardiac output varies from size to person, but the average resting cardiac output is 5 to 6 liters per minute. Notice that this amount is just about the same as a person's average volume of blood. At rest, the heart pumps all of the blood in the body within a minute. Changes are possible depending on circumstances and extent of physical activity. If we know reconsider the athletic, you will be able to see precisely why the athletic has a low resting pulse. In our formula, we'll use an average resting cardiac output is 5 liters and athletic pulse rate is 50. Okay, stroke volume into 500 beats per minute, 500 ml per stroke volume. Notice that the athletics resting stroke is volume is significantly higher than the average. The athletic most significant heart pumps more blood with each beat, so can maintain a normal resting cardiac output with fewer beats. I told you yesterday also, if you check the persons who are athletics, who are sports person, okay, their heartbeats are lesser than ours heartbeat. Why? Because in the amount of blood is pumped by the heart in one beat is more than us. Here, the 70 ml, 60 to 80 ml is the normal persons, but in the athletics, the 100 ml stroke is done in athletics. So that's the reason heart beats is low, because if you divide, if multiply 100 into 50, 5,000 means 5 liters. So in their 550 beats only, they are pumping 5 liters of blood. But we require 80, 70 beats per minute for pumping of blood to all parts of the body. Okay. Now let's see how the heartbeat responds to the exercise. This is the athletics. Now, when we exercise, how our heartbeat responds. Heart rate, pulse will increase during exercise. So this is the first thing. What will happen? Pulse rate increases, and so does stroke volume also. Stroke volume also increases. The increase in stroke volume is resulting of Starling loss of the heart. So this law names as Starling law of heart, which states that the more the cardiac muscle fibers are stretched, the more forcefully they contract. During exercise, more blood returns to the heart. This is called venous return. So basically, the blood comes from the body to the right atrium. Comes from the body, right atrium. So this coming, whatever the blood is returning from the body, this term is referred as venous return. What is we call venous return? Very, very important. Increased venous return stretch the myocardial of the ventricles because start uh, heartbeat starts from venous return. Okay, venous return. The blood comes from the body to the right atrium. So the myocardium stretches because large amount of blood is coming. So they have to contract forcefully and pump blood more. So here what will happen? Stroke volume increases. The amount of blood stored in the heart is known as stroke volume. So here stroke volume assume that 100 ml. During exercise, our heartbeat increases. So 100 beats per minute. Cardiac output is 10 liters. So here the amount of cardiac output is 100,000, 10,000 ml means 10 liters. So this is very, very important. We have to Remember, the exercise cardiac output is twice the resting cardiac output we first calculated, which should not be considered unusual. The cardiac output of a healthy young person may increase up to 4 times the resting level during strenuous exercise. The difference is the cardiac reserve. Basically, in the resting position, now I am resting, but I am teaching. My speech is going on. With the brain, I am thinking. Okay, but here that much amount of cardiac output is not there in my body because I am in resting position still now. Though I am talking, I am giving a speech or I am delivering the lecture to you. So my heart rate is normal. When I will walk, I will write in the board. Okay, so whatever functional things I will do, my heart rate increases. So you can double or 4 times of the normal resting will be the normal for the body. Okay, it will not give any harmful effect on the body. Means 20 liters, 20 liters of cardiac output is normal when you do strenuous exercise. Okay, the extra volume the heart can pump when necessary. If resting cardiac output is 5 liters and exercise cardiac output is 20 liters, I told you. The cardiac reserve is 15 liters. The marathon runner's cardiac outputs may increase 6 times or more compared to the resting level, and cardiac reserve is even greater than for the average young person. This is the result of the marathon's extremely efficient heart. Because of stunning life, is almost impossible to overwork a healthy heart, no matter how much the volume of venous rate increases. The ventricles simply pump more forcefully and increase the stroke volume and cardiac output. Also related to cardiac output and another measure of the health of the heart, ejection fraction. This is the percent of the blood in a ventricle that is pumped during systole. Okay, so here one another term you have to remember, that is blood volume we remembered, cardiac output you remember, stroke volume you remembered. Now we have ejection fraction. This is also will be given in 2D echo. Okay, so we will study in our radiology classes. Okay, please be attend to the radiology classes from tomorrow onwards. So basically here cardiac ejection fraction. Ejection fraction means your the whole amount of blood in the auricle or ventricle is nothing but stroke volume. But here only ventricles, how much amount of blood is present in the ventricle, and after blood goes from the ventricles to the aorta or pulmonary artery. So how much amount of blood is stored in the ventricles? So this is calculated as ejection fraction. If it Yeah, ventricles does not empty complete when it contracts. I told you now, but should pump out 60 to 70% of the blood within it. A lower percentage would indicate that ventricle is weakness. This aspect of physiology is summarized in table. I told you that the ventricles have to be contract and the blood in the ventricles should be go in the aorta or pulmonary artery or vein. Okay, pulmonary artery. So basically here 60 to 70% of ventricles will empty. If more than 60 to 70% or less than 60% is amount of blood is stored, what will happen? The ventricles are not working properly. So here ejection fraction is also important. So it should have to be more than 60%, not less than 60%. Ejection fraction is indication of how ventricles are working. Okay, this is the very important thing you have to remember. So here, physiology of the heart rate, okay, heart rate, stroke volume, cardiac output, ejection fraction, cardiac reserve. So these are the important terms you have to be identify as well as you have to remember because it is examined during your any patient will come. You have to examine these things when cardiologist will give 2D echo report. Okay. Now we will talk about regulation of heartbeat. How the heart. Now we'll discuss all things related to the heart. How the what are the structures of the heart, where are they situated, how the heart functions. So we talked about venous returns, okay, ejection fraction, stroke volume, okay, everything we learned. Now we'll talk about regulation of heart rate. So regulation of heart rate. Basically, heart is connected to the brain. Every part of the body is connected to the brain. So from then only, there only the heart and every part of the body will work. Okay. But heart have one conduction system, that is AV node, SA node, AV node. We studied yesterday. So even though brain is giving stimulation to the heart, but they have their own system. Heart have their own system of generating electricity. Okay. So how they work, we will learn. Combination of heart and brain here. The heart rate of contraction can be changed to adapt different situations. Because here, now my heart rate is 70. When I will walk, it will become 75. When I will run, it will become 88. I will do exercise, it will become 90. How this is happening? But it is not understood by the heart, but because it is understood by the nervous system. Nervous system is regulating this heartbeat. Okay, when you are resting, not doing any work, not doing anything, when you are sleeping, your heart rate is 50 to 60, which is very normal. Okay, so basically, so these things are related to the brain. Brain will manage all those things. Okay, how it manages, that's the nervous system can and does bring about necessary changes in heart rate as well as in force of contraction. So who will maintain, according to the condition, nervous system will maintain all those changes what happening in our body. So here one thing, that is medulla. You know about medulla oblongata. In our, here we have the, this is the midbrain, midbrain, hindbrain, and okay, all this brain stem is known as brain stem. This is the cerebellum, cerebrum, okay, cerebrum, cerebellum, pons, midbrain, hindbrain, all are in brainstem. So from that we have, you can see that two centers are there, one center and two centers that are connected to the acceleratory center and inhibitory center. Two centers are in medulla oblongata. Okay, so those are connected to the here, one to the SA node, one A to the AV node, and one to the right ventricle to the or Purkinje fibers, bundle of his and Purkinje fibers. Okay, here we are. So next is, here we have the nerves. These nerves are connected direct to the SA node, AV node. Okay, both are connected. So you can see accelerator center. You can see here very. You can see the red line is inhibitory center, which will decrease the heart rate. Here we have the acceleratory center, blue line. Here one branch, SA node, AV node, and Purkinje fibers or bundle of his. Okay. Next, here we have vagus nerve. Vagus nerve to the aortic arc, connect to the aortic arc, and here we have the glossopharyngeal nerves. Glossopharyngeal nerves is connected to the, one is for arteries, common carotid arteries, so which will go to the brain. Oh, okay, brain, aorta, arteries. Okay, so you have to remember all those things. There is a two centers in the brain, in the medulla oblongata. One is acceleratory center, one is inhibitory center. So acceleratory center will increase the heart rate according to the situation. Inhibitory center will decrease the heart rate according to the situation. Okay. Not only we have this inhibitory centers, but also they are connected to the arteries, large aortas, large veins. We have two nerves, that is vagus nerves and glossopharyngeal nerves. Okay. We have two nerves, that is glossopharyngeal nerve. So here two things you can understand. One is how it is work, because brain is the center of the body, it will control all the functions. Next is, if damage in the area, what will happen? It may be increase the heart rate, it may be decrease the heart rate. Okay, during stroke, if stroke occurs in the medulla oblongata, what will happen? Mostly persons die because the heart is connected to the medulla oblongata, or you can say small brain. Okay, small brain. Okay, so this is very, very important thing you have to remember. And next, so what will happen? We have two types of systems. One is sympathetic and parasympathetic nerves. Sympathetic means according to the condition, it will increase the function of the body. Okay, or it will increase. Mostly, it will increase the what you have you the energy to fight. Okay, what a parasympathetic means, it will decrease in unnecessary condition. You don't need heart rate to 100, 120 beats per minute. So it will decrease. So we have two types of systems here. One is parasympathetic and sympathetic. So glossopharyngeal is sympathetic and vagus is parasympathetic. Glossopharyngeal nerve is sympathetic and here vagus is parasympathetic. Here two things you have to remember. Our next question, what information is received by the medulla to initiate changes? Because the heart pumps blood, it is essential to maintain normal pressure. Blood contains oxygen which all tissues must receive continuously. Therefore, changes in blood pressures and oxygen level of the blood are stimuli for changes in heart rate. So basically, when will these receptors work? So according to what that, when our heart rate is normal, we are not doing any work, we are in resting position. Basically, the heart is in normal beat. When you are trying to walk, so the requirement of blood in the body is increased. So these are the sensory receptors. Okay, we have the receptors. Receptors will detect the changes. We have two types of receptors: presoreceptors, chemoreceptors. Okay, we have two types of receptors, that is presoreceptors. Presoreceptors will detect in blood pressure changes. Okay, what will happen? This amount of blood is okay for the body or not. If the blood is decrease, blood pressure decrease, they will sense that the body is the body is the body is having low amount of BP. So we need the increase in blood pressure. So pressure receptors will activate. Next, what will happen next? We have chemoreceptors. Chemoreceptor will have to always they have to check the blood oxygen levels. What they will check? They will check blood oxygen levels. So according to that, they will check the blood oxygen levels. If the blood oxygen levels is low, they will also activate. So we have two. The receptors will attack on two nerves. One is glossopharyngeal and we have vagus nerves. So according to that, the glossopharyngeal and vagus nerve will activate and they will inform to medulla oblongata. So from that, acceleratory or inhibitory center will activate. The changes will seen by their two receptors, chemoreceptors and presoreceptors. They will inform through their channels. Okay, parasympathetic or sympathetic, whatever may be the changes, the decrease or increase. Increase, they will inhibit. Decrease, they will accelerate. Okay. So these are the things we have to remember. Here one example is given. Let's talk about that example. A person who stands up suddenly from laying position may feel light-headed or dizzy for a few moments because blood pressure to the brain has decreased abruptly. The drop in blood pressure detected by the pressure receptors in the carotid sinus notice that there is on the way of the brain a very strategic location. The drop in blood pressure causes fewer impulse to be generated by the pressure receptors. These impulses travel along the glossopharyngeal nerves to the medulla and decrease the frequency of impulse stimulate the accelerator center. The accelerator center generates impulse that are carried by sympathetic nerves to SA node, AV node, and ventricular myocardium. As heart rate and force increases, blood pressure to the brain is raised to the normal, and sensation of lightheadedness passes when blood pressure to the brain is restored to normal. So here example is given. One person is there who is standing, basically who is standing. Okay. So when he's sitting, suddenly he is able to stand. Okay, he's standing now. Basically, what will happen? He have some sort of dizziness, or he have like a light-headed. What will happen? This light-headed sensation will detected by pressure receptors because the blood pressure is decreased to the brain. Okay, they detected. So what will happen? They from the glossopharyngeal nerve, they will activate accelerator center. From that nerve, sympathetic nerves will increase the heart rate. So the heart rate increases, the blood pressure increases. Okay. So SA node, AV node contract accelerated by the help of medulla acceleratory center. Okay. So these are the things we have to remember. So this is the pathway. This pathway is very, very important. So in this pathway also, is there any damage? What will happen? The heart pumping capacity of the heart is also disturbed. Okay. So I think you understand the chapter. Okay. So you can hear one thing is that aging and the heart. Basically, the heart muscles become less efficient with age, and there is decrease in both maximum cardiac output and heart rate. Although resting levels may be more than adequate, the health of the myocardium depends on its blood supply. And with age, there is greater likelihood that atherosclerosis will narrow the coronary arteries. Atherosclerosis is the deposit of the cholesterol on in the walls of arteries, which decrease blood flow and forms of surface that may cause intravascular clot formation. High blood pressure causes the left ventricle to work harder, may enlarge and outgrow its blood supply, thus becoming weaker. A weak ventricle is not efficient pump. Such weakness may progress to congestive heart failure, such as progression may be slow or may be rapid. The heart valves may become thickened by fibrosis, leading to heart murmurs and less efficient pumping. Arrhythmias are also more common with age, as the cells of conduction pathway becomes less efficient. So basically here, according to the age, we will have different diseases in the body. One is deposition of cholesterol in the arteries, so which will lead uh, damage or clot formation. And in coming age, we have hypertension, which is increase the workflow of ventricles. If ventricles pump rapidly, what will happen? The whatever valves we have, they will become harder, weaker. Okay, so gradually they will form congestive heart failure. Okay, it will cause congestive heart failure, arrhythmia, whatever may be the condition. So basically, to avoid all those things, we have to maintain, we have to avoid all the oil foods, all the cholesterol uh, or fat substances, or to avoid uh, salt. We have to take minimum amount of salt. So it will, and we have to do regular exercise, which will keep our body healthy. And we have to take adequate amount of sleep, how to rest our body. So these are the things very, very important to maintain the health of heart. Okay. So I think we completed the heart topic. If anyone have any doubts, please clarify. And one thing is Miss, that is ECG. Okay, I told you that after completion of the subject, we will talk about ECG. So basically, ECG is basic ECG we will study now. Advanced ECG we will study in medicine. Okay. So if any doubt, tomorrow we will talk about ECG. Okay. Tomorrow we will discuss about ECG. Okay. Please, if anyone have any doubt, please ask. We have 2 to 3 minutes